A patient has a bacterial infection. The majority of the bacteria, shown here in white, are susceptible to antibiotics, but in some cases, a few of the bacteria, shown in grey, may not be. These bacteria are resistant to antibiotics. The patient is prescribed antibiotics and starts taking them. The antibiotic will kill off all the susceptible white bacteria, but the grey-resistant bacteria will survive. These antibiotic-resistant bacteria will now reproduce. And in time, the resistant bacteria will confer their resistance to other formerly susceptible bacteria. Since the advent of antibiotics in the 1940s, germs have found ever new and ingenious methods to become resistant against the antibiotic drugs we attack them with. In principle, there are 4 different ways in which a germ or pathogen can become resistant. Number 1 could be described as getting rid of an unwanted intruder by flushing them out. The official name for this process is drug excretion. This means that when an antibiotic has entered the pathogen, the germ activates something called an efflux pump. This structure effectively removes the antibiotic by moving it to the outside of the germ. Number 2 is even simpler. The pathogen changes the structure of its outer membrane, in effect, its castle wall, and hence its permeability. This makes it impossible for antibiotics to enter the pathogen in the first place. Number 3 is known as enzymatic inactivation. Here, the pathogen allows the antibiotic to enter but produces an enzyme that destroys the antibiotic structure, rendering it useless. Perhaps the most cunning way is known as modifications on the drug target. What happens here is this. Antibiotics have a key target structure inside the bacterial cell, which they target and then destroy. However, pathogens can change the protein structure of this target site, making it impossible for the antibiotic to dock onto the site and therefore making it ineffective at killing the bacterium. As you can see, germs are very adept at finding ways to counteract the various ways in which we try to kill them. The battle continues.